Hi, Chris Montera here at EMS Today 2015, and we're here in the Physio Control podcast studio, and we're talking with the EMS 10 awardees. And today I'm really happy to be talking to probably one, I don't know, I think he's a great friend, Dr. Dan Swayze.
Hello, sir. Hi, Chris. How are you?
I'm great. So tell people about who you are and a little bit about your background.
I come from Pittsburgh, Pennsylvania, in the Center for Emergency Medicine, where we've been working on this community paramedicine stuff for a little over 10 years now. And got into it thinking that there's got to be a better way to reimburse EMS providers than just for transportation stuff. It seemed pretty silly to have them get paid for transportation but providing all the clinical care that they provided. So we've been trying for the past 10 years to experiment and see what works financially, what works for the patients, and what works for the providers that are out there, and have had some success with it.
So you were a paramedic,
I
not
was
any longer?
A long time ago.
A long time ago.
20 years ago since I've been in an ambulance. Patient safety issues that keep me off.
So when you were back in the day,
Yeah.
did you ever think we'd be doing this?
No.
Did you ever think we'd be moving down that direction?
Heck no. Heck no. I mean, you were trained to intervene in 911. It was all about the emergency stuff. It was all about cardiac arrest saves and the car accidents and doing that type of stuff. And no, I would have never predicted it 20 years ago that I've been doing this type of work today. But I got to tell you, I love it. It's so different. It's so cool to help patients in this way.
So tell me a little bit about the Center for Emergency Medicine. Is that right?
Okay. Yeah.
So let's go back a little. Let's go way back.
Yeah.
Dr. Ron Stewart started that.
He did.
And how did he bring you in?
No.
No.
Now, I got there at the second generation, so he brought in my mentor, the guy by the name of Dr. Paul Paris, and Paul recruited me to come in to work for the center there at the time as the director for pre-hospital care, but Ron's vision, the culture that he created in this organization is unlike anything I've seen anywhere else in the country, where you just have this energy around how do we help people in EMS help other people? How do we help them do it better than they've done? So he created this center. There's an air medical component, Stat Medevac. It's one of the largest not-for-profit helicopter programs in the country, and it's well known for its innovation and safety and the clinical care that it provides. They have the Office of Research, which is literally the world's most prolific institute for pre-hospital care and emergency medicine research. They publish more articles than anybody else in the world does. You have the Office of Education with folks like Dr. Waltstoy and Tom Platt and a whole generation of new educators that are coming in that are really just shaping how EMS providers that are taught. And then the newest division is the one that I helped found called EMed Health, which is the earliest exploration into community paramedicine in there. And it's just really a neat place where you can walk down the hallway and have all these MDs, PhDs, and people that are just dedicated to making EMS better.
So that brings me then, so when you started EMed Health, what were kind of some of your guiding principles, or did you just kind of go, oh, let's see if it sticks to the wall? I mean, you obviously had some vision for that.
Yeah, we knew that early on. What we did in the initial grant that we got was just test the feasibilities. This stuff that EMS providers are even going to be interested in doing, because it's not what they were trained to do. And what we got was overwhelming feedback, like, yeah, we'd love to, but there's financial barriers. We don't know what programs to run. We don't know how all this works. So from the beginning, what we focused on was developing evidence-based interventions, things that we knew that there was some science to support in what we were doing, and that we could make financially sustainable for the providers, because we did not want EMS to have to continue to subsidize healthcare the way that they've been doing for all of these years, where they're struggling to make ends meet. You're the CEO of an organization. Right. I mean, you're essentially subsidizing the municipalities and the provision of this essential service that they have to do, that they don't give you enough money to run, and so we didn't want that to be yet another burden that EMS administrators had to face with all this. So we wanted to look for those things that we knew that somebody in the healthcare system, whether it's the individual or the big healthcare payer, would be interested, because there'd be some value for them in providing all these services.
Wow. So what do you think, how many I've heard a statistic, I think you told me once, that you've had 50,000 patients in your
we're probably
overall...
closer to 70,000 now at this point. Yeah.
And that's how many lives you've touched over 10 years?
Yeah.
It's absolutely amazing.
It's incredible, and the experiences of each one of those patients is so different and unique. It's so neat to see people, and the vast majority of those are the simple things, like giving flu shots to tens of thousands of people to make sure that they don't get the flu, and which is one of the leading causes of death in this country. It's huge. We save more lives through flu shots than we ever do through ACLS, right? And so it's an opportunity for medics to get involved in that kind of procedure.
You mean Ebola's not going to kill us?
I don't think so.
Okay,
I think we're pretty safe. At least not me. I don't have any plans to go to Liberia anytime soon. So. And then you look at the health screenings that we do, which is another huge portion, 10, 15, 20,000 people that we push through those, where we let them know, hey, you think you're healthy, but you're walking around and you could have undiagnosed hypertension, hyperlipidemia, you could have diabetes, any of these types of things. So we show them the numbers and tell them where they stand, and a lot of people just never think to get that stuff checked because they feel fine, and this is the clue that, hey, if you don't do something different in the near future, you could really suffer some severe health consequences, and so that's meaningful. All the way up to the one-on-one counseling we do with some really, really challenging, vulnerable patients, very fragile patients that just are desperate for somebody to come up and to get into their lives and help them find the resources they need to better manage their lives and live better. Is just incredibly powerful work. So
right on,
that's
right
cool.
on. So what's next for you guys? What do you see as the next thing for you guys in the visionary place that you want to go?
Yeah, so I think we're pretty schizophrenic in that regard. We're all over the place with what needs to be done because we're so early at this. There's so much left to be done. So I think the next challenge for us is as where many programs are, is the sustainability piece. And in our particular county, we have 45 EMS agencies in our county. That's a pretty fragmented system, right? We have 15 different hospitals that we're trying to work with, and 2 very highly competitive health systems trying to coordinate all of the care in that region. And so for us to develop a sustainable model in that market, I think would be a real powerful model to take to the rest of the country, saying if we can figure this out in Pittsburgh, we can do this anywhere. We can transplant this to other municipalities, we can transplant this to other market areas, health service districts, whatever they are, and really get all of those different entities with all of their own biases on how things should be done, to get them to collaborate and cooperate on developing what ultimately is the best thing for those patients, I think is something that we're just at that cusp now. We've got some great data coming out of the program. We've got a lot of great case stories that we can share with folks about how this is done. We've learned a ton of lessons about what not to do as we develop this and what's important to sustain these programs moving forward. And so I think we're going to leverage all of that into the next 5 or 10 years of this operation and take it to the next level and just make sure that it's around to help these patients out.
Right on. Well, I applaud the work you do. You've helped move us forward tremendously, and I don't say that very lightly, because I think you have been out there at the forefront. You are willing to share, and I think that's what this is about. Because we can't, not any one of us is going to make $1 billion on this, but it's the right thing to do. And I think you share that passion, and I see that in a lot of the work. And I think a lot of that too comes from that foundation from Dr. Stewart. I mean, it just really does. That this is something we've got to have out there forever.
Yeah.
So my final question for you, Physio has done a great job at starting to recognize us as an industry.
Yep.
What do you see? How do you value that? Do you value somebody looking at us and trying to put us up on a pedestal, because we're not very good at it as EMS providers?
Yeah, it's one of the lessons that I think I've learned the hard way, that when you are humble in your successes and when you don't share the successes that you've had with other people, it's hard to convince other people that you're doing the right thing, right? So as more recognition gets applied to EMS, which is so long overdue for the incredible work that all of the providers do that are going out there, this just helps not only increase the recognition of the profession, it helps bring the resources that they need to help other people to the profession. So the more that we can promote the successes, not just in community paramedicine or mobile integrated health, but every success that we have, cardiac arrest saves and helping stroke patients and helping patients with CHF, and down to helping these incredibly vulnerable patients, that's all going to benefit us, because it's going to bring more traction, more attention to the field, and people really figure out that these are highly trained clinicians that we have out in these communities, and we have not been using them to the extent that we should. And shame on us as a healthcare system, shame on us as a country for not recognizing the value that they bring to there. So I absolutely applaud Physio for the attention that they're bringing to this and all the work and that they're doing to kind of create this momentum behind the industry here.
Right on.
It's fabulous.
Dr. Swayze, thank you so much, and thank you for moving us ahead in light years. And I'd like to thank you for watching this video and watching us interview the EMS 10 winners at EMS Today 2015 from the Physio Control podcast studio. And we'd really like to thank Physio Control for sharing with us their vision for what we want to be as the next leaders in EMS. I'm Chris Montero, and keep watching more videos right here at emstoday.com or on the ProMed Network. Thank you.